Alright, so knock, knock, knock. I perform my hand hygiene. Hi, Mr. Wan. I'm Emily. I'm a student nurse from Harper. I'm here to do an assessment of your nose, mouth, and throat. How are you today?
I'm doing good. How are you?
I'm good. Alright, I'm going to start by asking you a couple questions. First, do you have a history of nosebleeds?
Nope.
Okay. And do you have any sinus pain recently?
No.
Okay. How about seasonal allergies?
None.
Alright. And how many times a day do you brush your teeth?
Twice a day?
Do you have any pain in your teeth when you do that?
No.
No sensitivity?
Nope.
Okay, how about, do your gums bleed when you floss or brush your teeth?
No.
Okay, good. So I'm going to start with the inspection and palpation of his nose. From here I can note the nose is symmetrical, it's midline, there's no discoloration of the nose, his nares, they're not flaring, and if you could lift up, so I'll look inside of his nostrils, so I don't notice any perforation of his septum, which is seen in chronic cocaine users, so the holes, there's no holes, and then also his septum is not deviated and his nostrils are equal at both sides, and then again there's no apparent abnormalities, lesions, or bumps that I can see. So if you could take off your glasses, I'm going to palpate your nose, so let me know if you have any pain.
Oh, okay.
So when I do this, I'm just gently pressing down and looking for any bumps or masses, which I don't feel. And do you have any pain or tenderness?
Nope.
Okay, good. So you can put your glasses back on. Next, I'm going to test the patency of your nostrils. So if you could cover up your right nostril and breathe through your left. All right. And if you could do the same on the other side. So while he does this, there's no difficulties or obstructions with breathing. Both of his nostrils are patent. And then I'm going to palpate your sinuses. So if you want to take your glasses off again.
Okay.
I'm going to be doing the maxillary sinus and the frontal sinuses. So you let me know if you have any pain with this.
Mm-hmm.
So any pain?
Nope.
And this is the maxillary sinus. And then any pain here?
No.
And this is his frontal sinus. Okay? So now I'm going to put on my gloves and my mask. So 1 second, Mr. Wan.
Okay. Cool mask.
Thank you. It's okay. Alrighty. So I'm putting the mask on because I'm looking in your mouth. And I'm going to start off first with your lips. They're evenly distributed. They're not chapped. They're moist and pink, which is normal, and they're also symmetrical. And then if you could open your mouth, I'm looking at his teeth. If you could smile. They're white and clean. I don't note any dental caries or any missing teeth, and they're evenly spaced, which is normal. And then if you could open your mouth again, I'll look at his gums. His gums are pink, moist, and evenly distributed. There's no discoloration. Signs of tightness in the margins or any bleeding noted, which again is normal. There's also no ulcers noted. Okay, and then I'm going to use my tongue blade. And I'm going to look at the buccal lining of your mouth. So I'll start on your right side. Again, it's pink and moist, which is normal. The color is evenly distributed. There's no ulcers or canker sores that I can see. And I'll come and do the same on your left side. Again, it's pink, evenly distributed, pink and moist, and no ulcerations that I can see. Okay? And then I'm going to just set this aside. No, throw it out. Okay. And I'm going to have you, let me see your tongue. So this is his dorsal surface of the tongue. It's rough, which is normal, but it's also pink and moist. There's no ulcerations and which is a normal finding. No discoloration or no white film or mucus that's covering the tongue. Okay, so so then if you could touch your tongue to the top of your mouth, looking at the ventral side of his tongue, it's shiny, moist, and pink. If you could tilt your head down a little bit, the underside of the tongue is also shiny, moist, and pink, which is normal. The veins are visible again, which is normal, and there's no ulcerations or issues with that. Okay, so now I'm gonna look at the roof of your mouth, so the hard and soft palate. Again, I'm looking for any discoloration or abnormalities with that. It's evenly colored. There's no ulcers, and it's pink and moist, which is normal. And then if you could tilt your head down a little bit and just kind of stick out your tongue. Yes. So when I do that, I'm looking at his tonsils. His tonsils are slightly visible, which is normal. They're not inflamed, so I would rate that as a +1. And then I'm going to have you stick out your tongue again and say, ah. So when he does that, I'm testing the cranial nerve, the glossopharyngeal, and the vagus nerve. I note the rise and fall of the rise of his uvula, and then the rise of the soft palate. And his uvula is midline. It's not split, which is also a normal finding. And lastly, if you could just stick out your tongue for me. His tongue is midline, and when he does this, this is testing the cranial nerve, the hypoglossal-cranial nerve, and that is a normal finding. Okay, so I'm going to take off my gloves, throw them out, perform my hand hygiene, and take off my mask. All right, Mr. Wan, that is the end of our nose, mouth, and throat assessment.
Sweet.
All right, so I'll perform my hand hygiene and leave.
Thank you.